Well, good afternoon, everyone. I'm glad to see that you're staying and that you now have been fed again. This is our part 2 session, and I'd like to thank the members of the Planning Committee for inviting me to be here today and to be a part of this prestigious panel that we're going to have in just a moment. And also to thank you for staying and being here on a Saturday morning, and thanking our listeners also that are streaming with us. So, how many of you have heard about the term survivorship? All right, so how many of you have been a cancer survivor or a cancer patient? Please raise your hands. How many of you are a family member, a friend, or a caregiver of someone that's been? So basically, every one of you in this room sitting here right now is a cancer survivor of some sort, okay? And so I'm going to go over some of the definitions of that in just a moment. So these are basically the things that we're going to be discussing today. Who and what, when does one become a cancer survivor? What is cancer survivorship and why does it matter? When is the time to seek information, support, and from whom? So cancer survivorship really started coming to light in 1985 by a physician named Fitzhugh Mullen. And he developed cancer and started writing about the different experiences he was having as a cancer patient and then as a survivor. And he called these the seasons of survival. And if any of you ever want to Google that and read the article, it's very moving, and it's very interesting to hear that so many of the seeds that he planted back then are still existing, and the thoughts and the reactions and some of the experiences that he had are still being experienced and voiced by our survivors today. So in 2005, then, it kept kind of being beneath the surface, survivorship. And so then the Institute of Medicine in 2005 launched this report called From Cancer Patient to Cancer Survivor, Lost in Transition. And so what was that kind of summarized the feelings that had been voiced by Dr. Mullen and also by many of our survivors that said, when I was a cancer patient, everyone was there for me. Right away, my healthcare professional team was there. I could call them, and I could make an appointment. And then they said, okay, you finished your curative treatment. Everything's fine now. And so you can go on and live your normal life. But normal life at that point was very different because it really wasn't normal, because people maybe had some side effects, they had some residual late effects later on, and so it wasn't as easy then to come back and pick up the phone and say, hey, I'm feeling this right now, what can I do? So they kind of felt like they were in a gray zone or being lost in transition when they moved from being an active cancer patient or a patient in active treatment to one who was considered post-treatment or needed follow-up care. And that's where we started hearing more of the term of survivor and survivorship. This book, though, even though it came out in 2005, set the guiding principles for survivorship. So it's kind of the gold standard for all clinicians, for researchers, for patients and survivors, as well as for our policymakers. So this is available online from the Institute of Medicine. It's free. And so if any of you want to maybe peruse it and just kind of see what it has, I think you'll learn a lot from it. And I'll highlight some of those, the most important facts for us today in the brief period of time that we have in the next few moments. So briefly, I'd just like to highlight a few points here. We know cancer survivors are increasing in number. In fact, by 2024, we're going to see almost 19 million. I think this is what's the most exciting thing for me. I've been in cancer since I was a baby cancer nurse many, many years ago, about 30-some years ago. And back then, we were just trying to see how can we make someone live longer, when we were looking at the magic 5-year. That was what everybody wanted to get to. If I get to that 5 years, that's going to be great. But now look at this. We have survivors that are living 25 years or longer after their cancer diagnosis. And again, over the next 10 years, we're going to see a 37% increase. So what's happened as all of the involvement and all the focus has gone on with survivorship care, we are now seeing it as an established component of the cancer continuum. Before, it used to start maybe with prevention and then go to palliative care, and now we're actually seeing, okay, survivorship is actually a phase before we even get to palliative care, because so many of our survivors are living now. And so it continues to grow as a public health concern, again, for survivors, and it's a really promising area for research, and that's what I do. I do a lot of research on our survivors and especially the ones that are living 5, 10, 15 years later, and what are some of the late effects that they're experiencing, and what are some of the services that they are receiving as survivors of a particular cancer. For those of you that like illustrations, this again kind of summarizes some of the trends that you've been hearing about this morning by some of our speakers. You can see from 1977 to 2022, there is a gradual increase in our survivors. And you can see from here, the bar just gradually going up. Here's our 1977, and here's 2022. But this is even more, has more detail, because if you look at the different color bars that are there, the bars at the very top symbolize the people who have lived 15 years or longer. Look how much that has grown over the period of time, and how much it's projected to continue to grow here on this slide until 2022. That's a very exciting and a very promising slide, and it says a lot with just that picture of those graphs that are there, the bars. It tells us, hey, we are making great strides in cancer. Look at this, people are living longer, and people who live 25 years or 15 years or more are living longer. So again, a lot of exciting information in this one slide. Now, even though the Institute of Medicine report kind of defined who a cancer survivor is, there's still a lot of controversy or debate on what term to use, and it really depends on when this term is being applied to an individual and how it's being applied to an individual. The original one, the traditional definition, came from the National Coalition of Cancer Survivors. Who is a cancer survivor? It's someone from the time of diagnosis and for the balance of life. That's the norm for the community, cancer community and beyond. It includes the friends, the families, the caregivers, and anyone else who's in that social support system that you heard about earlier this morning. So that's why I asked who in this room is XYZ, and every one of you became a survivor. The National Cancer Institute fine-tuned it a bit and said it focuses on the health and life of a person with cancer post-treatment until the end of life. So cancer post-treatment means you've completed that curative treatment for that primary cancer you have, and now you've been released and you can go back to your normal life. And again, they included the family members, the friends, and the caregivers. The ASCO Society of Clinical Oncologists, ASCO, and the European Organization of Research and Treatment have it as any person who has been diagnosed with cancer, but then they also say who has completed their primary treatment with the exception of maintenance therapy and has no evidence of disease. So they fine-tune it a little bit more, and they do this because they want to have this information for clinical trials. So that way there won't be any confusion about, am I a cancer survivor because I'm a newly diagnosed cancer patient, or am I a cancer survivor who has completed treatment? So for many of the clinical trials for cancer survivors only, this is the definition. The latter one is the definition they tend to use. A couple of investigators, though, started saying, we've done so much in survivorship, and this is the definition, but there are groups or phases of survivorship that an individual goes through, and these investigators were called Sorbonne and Tralango. And so what they said is there's really 4 phases that the survivorship journey consists of, or the cancer journey also consists of: acute, chronic, long-term, and cured. So the first one, again, it's those who are in active treatment and they require the oncology care. The second one are individuals with cancer that slowly progresses or alternates between phases of remission and relapse. The patient survivor in long term, though, then, is one who has remained at risk for distant relapse or second cancers and who may experience post-treatment related medical or psychosocial late effects that we've heard about earlier today, the cognitive and the lymphedema and some of these others. The cured individual, though, is a disease-free patient or survivor whose cancer life expectancy is going to equal a person with the same gender and the same age from the general population. And most of us in this room are at risk to cancer anyway, so that kind of puts that individual who's cured in the same category as the general population. So why does it matter? Why do we need survivorship care as a subspecialty now in oncology? Well, you heard this morning, the whole morning was spent talking about the long-term and late effects of cancer. You, and many of you sitting in this room as survivors probably are experiencing some of these sequelae already. There's physical and medical, so the fatigue, the pain, the lymphedema, less physical activity because of the fatigue. There's sleep disturbance. Psychological, there's sadness, depression, anxiety, worry, or uncertainty. In fact, one of the number one concerns of our survivors that we have found in some of the research we've completed here is the worry of recurrence. Am I going to get a new cancer again? And so that kind of then feeds right into all of these other psychosocial conditions that are listed here. Then there's also those social effects that happen, the changes in the interpersonal relationships, the concerns regarding insurance, or any type of financial burdens. And one of our panelists is going to be talking about that in just a moment. And then also, maybe if you're having less activity, what are some of the things that, that you might be able, that you've lost? I've heard somebody say they were a runner now. And so, we want our survivors now, as well as our patients, to keep up as much of that physical activity as possible, because we have learned that that past thing that we used to say, oh, you need to rest because you have cancer, that doesn't work. We want people now to be active, even if it means walking back and forth between two chairs 5 times a day or however long they can do it. That is still some type of physical activity instead of lying in bed all day long and saying, oh, I don't feel like getting up. We want people up and moving now. So the IOM report that I spoke about earlier, and even now, follows like core elements, or has identified core elements of cancer survivorship care. And so these are the core elements. It's the 4 in the center. So we see cancer surveillance, cancer prevention and screening, late and long-term effects, and then keeping the good mental health. And outside of this, you see what the primary focus is of each one of these core elements. So surveillance has been around forever. Even when I was, 30 years ago, just starting as an oncology nurse, that's probably what most of our patients were receiving. They'd come in, see their oncologist, they would check them, do lab work, do any, a physical, a history, some types of procedures or studies, and then they would determine whether this person was okay, ready to go back home again, or was there something that they needed to do again as far as watching them for a primary or secondary cancer. So now, again, these are the core elements that we watch people for now. And so the ones that have really come into play is the cancer prevention and screening, risk reduction, how do I maintain my wellness, how do I maintain my health, the psychosocial status, how do I deal with these things that we talked about, like the sadness, the depression, and that worry, and then watching for changes in the health. How do I get this care is one of the other things that people ask. Okay, you told me I need this type of care. You told me why. You told me the elements, but how do I go about getting it? And these are some of the models that are used right now in cancer care to provide this care as post-treatment follow-up care. Multidisciplinary clinics, and these involve multiple providers, and you're going to hear from our panelists who represent these multiple provider teams. Consultative clinics, where the patient is referred somewhere for survivorship care. Integrated clinics, where they have a survivor that's a survivorship provider on the team. And then disease-specific clinics. Here at Anderson, we have a combination of multidisciplinary and disease-specific. Right now, we have 13 different clinics that are focused only on our cancer survivors according to the type of disease they have. Now, this is something I'd like for you all to remember. The Commission on Cancer Regulations is the one that accredits all of our cancer hospitals, including our institution, for cancer care. And they're saying now that every cancer patient, once they have completed treatment, need to receive a treatment summary that includes important disease characteristics and treatment-related information and a summary care plan. That summary care plan is like your roadmap for the rest of your life. That is what's going to tell your team, your primary care provider, what is it that you need to be doing as far as reducing your risk, maintaining a new lifestyle, and also watching for late effects or monitoring for second cancers. So very quickly, these are some of the sites that you can get to look at these. The ASCO Cancer Treatment Survivor Care Center, the Journey Forward, and OncoLink. And then just quickly, I just want to show you, for our clinicians, we also have roadmaps to help them determine what are the components that they need to deliver during a survivorship visit. And so here again, you see the same elements that we spoke about. with the risk reduction, diet, weight management counseling, exercise, monitoring for late effects, assessing for lymphedema, which you heard this morning, autoimmune reactions to this, and then psychosocial, and when we're looking at distress. So there's several resources that aim at melanoma. Your organization has super resources on your website. They have even Speak with Our Oncology Nurse Service. There's lots of printed material. Those of you that like to use the websites and social media tools, be very careful about what you choose to look onto and choose to read. And then even your family members or yourself can be a resource for information. So overall, in closing, these are the main points that I want to leave with you. Health of survivors must be maintained by stressing the importance of follow-up care. Coordinated care models help provide an optimal patient experience. Communication is critical. It's key between the provider and the survivors and, of course, the family members. And then strong collaboration across all specialties can contribute to a better quality of life for each of you sitting in this room. And now, just one last thing. I want to see, I don't know how many of you picked up this magazine that's available. It's on some of the desks. It has an excellent article on page 16 about routine health for cancer survivors. So I encourage you to try to read that or get the magazine. Thank you for your time.